Good morning. Hello again. I'm Ted Meyerson, a volunteer with AARP Maryland. I'm speaking with Melanie Cavaliere, who is with the Maryland Healthcare Commission. Melanie, tell us a little about yourself and tell us, what is the Maryland Healthcare Commission?
So good morning, Ted. Thank you for allowing me to share information about my organization with your listeners. So the Maryland Healthcare Commission, or MHCC, is an independent state regulatory agency. I'm the Chief of Innovative Care Delivery at MHCC. I've been in the healthcare industry for about 27 years, and I worked for 17 years in private industry and healthcare consulting, and I've been at the state of Maryland for about 10 and a half years.
Okay, so what does the Maryland Healthcare Commission do for me, for Marylanders?
So what we do is we provide accessible information on healthcare quality and costs so that Marylanders can make informed healthcare decisions.
That sounds so simple. How do you do that? And how do I
So
make use of it?
Yeah, so we do that in many different ways, but I want to start out a little bit by telling you about our mission. So one of the parts of our mission includes improving access to care. So the healthcare needs in communities are constantly changing. So to help ensure access to quality, affordable care throughout the state for residents, we provide timely, accurate information on care quality, availability, and cost. Our mission includes education. So we provide the information that's needed for Marylanders to make informed healthcare decisions and to hold the healthcare system accountable. And we plan and innovate. So we develop strategic plans and innovative solutions that ensure that the state's healthcare system can meet the changing needs of the communities now and in the future.
All right, so you get all this information and you have it. How do I get it and how do I make use of it?
So we have several ways for Marylanders to use that information. So the first is we maintain a healthcare quality reports consumer website. So that website streamlines 4 initiatives, which is information on hospitals, long-term care, ambulatory surgery centers, and commercial health plans, and it puts it into one consumer-friendly website. Consumers can find and compare patient ratings, safety and quality results, service volumes, cost, and other data for up to 5 facilities at a time. We also provide consumers with information about price at different facilities so they can make informed decisions about their care. And that includes room rates for nursing homes and assisted living facilities, daily rates for nursing homes and adult medical daycares, and volume and price information for medical conditions that are treated at Maryland hospitals. So another way that we educate consumers is we have a website that's called Where the Cost. So this website was created in 2017. And what it does is it shows patients an average and expected cost for several standard hospital procedures at different Maryland hospitals. And then it also provides the costs associated with potentially avoidable complications and surgical mistakes. And then it allows the consumers to run custom reports on the website.
So when you talk about costs, are they specific to individual places, individual hospitals, individual long-term care? So I can look up the long-term care up the street from me and make a determination of its cost relative to one 10 miles away.
Right. So it allows you to compare costs for different facilities so you can see what works best for your situation.
And what about the quality within those parameters, within those homes and hospitals and whatever?
So there are quality ratings for all of the nursing homes. For the hospitals, we generally point people to the CMS comparisons for hospitals.
Okay, so CMS has one. That's a computer. No.
Oh, so the Centers for
Okay.
Medicare and Medicaid Services.
Okay.
We also have quality. I mean, there's quality reporting for all of the healthcare aspects in Maryland, so people can go on there and see, how the quality compares for different facilities.
Well, we know there's a lot of disparities in healthcare. How do you address those?
So we have several initiatives that are designed to address disparities because, healthcare access is the key to overcoming these disparities that have negative, often life-changing impacts on peoples and communities. So one of the ways that we do this is we held a health equity symposium. We did this in collaboration with other state agencies and medical societies to highlight challenges and opportunities for addressing matters of health equity. So the attendees learned about strategies for identifying need in the community, building referral networks for services related to social needs, and connecting patients to resources. Another thing that we did is we expanded access to preventive care and management of chronic conditions by supporting the Maryland Primary Care Program, or MDPCP. So the MDPCP is an essential part of the Maryland Total Cost of Care model. It expands access to primary care services by providing funding and support for the delivery of high-quality primary care. Another thing that we did is supported telehealth innovation after the end of the publicly declared COVID-19 public health emergency declaration. So we're mandated to study the cost and clinical effort to deliver healthcare services through telehealth, and to study the adequacy of reimbursement for primary care and behavioral health services. So these studies are underway, and they're going to be reported to legislature at the end of calendar year 2024. Another thing that is important here in Maryland is we increased research and reporting on nursing home acquisitions. So in the last 2 years, concerns have been expressed in Maryland and other states about changes that are occurring in the ownership and operation of nursing homes. So in response to that, reporting was expanded to provide background information on the entities that are acquiring nursing homes and what's their track record of operation. And that's reflected in the CMS Nursing Home Compare. So the concern in Maryland is that the acquiring entities don't have good performance track records, or they operate under business models that may drive changes that are undesirable from the perspectives of patient safety and high quality care. So the result of this concern is that the Maryland Department of Health has been mandated to increase inspection survey activity for newly acquired nursing homes. We do think it's likely that Maryland will consider further regulations in the regulatory oversight of nursing home acquisitions. Another thing we do is track and encourage the use of hospice services. So hospice can be immensely helpful for patients and families that are facing terminal illnesses. So we encourage the use of hospice care and designed and disseminated brochures and electronic materials that can explain the benefits. We oversee the Maryland Trauma Physician Services Fund. This fund provides payments to offset cost of uncompensated and undercompensated care that's provided by trauma physicians, and it also gives them stipends and grant funding for equipment. Another thing that we did is to support the work of the Prescription Drug Affordability Board. We know this is an issue for everyone, right? The mission of the board is to try to protect Marylanders from high prescription drug costs, which can prevent individuals from being able to afford their medications and can actually make existing disparities worse. So we support the board with timely and accurate data on prescription drug claims.
Well, what do you do in your spare time?
we
Oh
study
goodness.
healthcare issues.
What a long list that you guys do. That's amazing. That's amazing. And I understand that you also are involved with CRISP. What is CRISP?
So CRISP is the state designated health information exchange. So in a 2009 law charged us and the Health Services Cost Review Commission, which oversees the hospitals, to designate a statewide HIE every 3 years. So that statewide HIE is responsible for building and maintaining technical infrastructure to exchange data between providers. So CRISP stands for the Chesapeake Regional Information System for Our Patients. And they were competitively selected in 2009 and have been chosen at each designation cycle based on their performance. So, what they do is healthcare providers share information through CRISP that they believe is vital knowledge for other healthcare providers. They connect to all 43 hospitals and share hospital information like discharge paperwork and labs. Certain sensitive information like addiction treatment details can only be shared with written consent. But they have access to health records from doctors, hospitals, and pharmacies, and the providers may share test results, radiology images, notes, and other information. And they also have a summary that has critical health information. So one important thing that CRISP stores and shares are advanced directives.
Okay. Before we get to talk about advanced directives,
Uh-huh.
what I understand you're saying is, in terms of CRISP, if I were to be in Garrett County and slip and hit my head and I'm taken to a hospital, my medical records would be accessible by that hospital so that they would know my medical history and be able to properly treat me. Is that right?
Well, CRISP doesn't have all medical records, but they do have a lot of different medical records. So the value, let's say you did have an accident in Garrett County, was that that hospital information is always available. So if you came back home and they wanted you to follow up with a doctor when you came back home, your doctor would be able to see the hospital information. We are working towards CRISP being able to have all the information for all the providers, but right now, there's certain information that's available and more information is being available all the time. But that is the idea, so that if you were in a different part of the state and something happened to you, somebody could be able to access your records to better treat your condition. That way they would know maybe you have a heart condition, maybe you have diabetes, and you're unconscious and can't tell them these things yourself. And maybe your loved ones aren't with you, but they would be able to access this information electronically, see prescriptions, see other procedures you'd have done and what medications you're on.
That's amazing.
It is amazing.
And you were talking about not being able to communicate, and that's where an advanced directive comes in, correct?
Yeah, so Marylanders have the option to create an advanced directive. So that's a useful and legal way where they can direct healthcare when they can't speak for themselves. I use the example where you hit your head, maybe you're unconscious, maybe you have, it's a bad accident, right? And you're not able to communicate details. So this advanced directive can give them information such as when you want them to use life-sustaining treatments or what medications you prefer. So there's various forms that are available from healthcare providers, religious organizations, state planners, lawyers, and others. There's no specific form that must be used. Marylanders can personalize that information. They should provide a copy of that to their family, healthcare provider, lawyer, or anyone else who should be aware of their decisions. You can revoke that advanced directive and you can complete a new one at any time.
Okay, so I've also heard about electronic advanced directives.
Yeah,
What are they and why are they important?
Yeah, I mean, an electronic advanced directive can be most effective because it's easily accessible by a healthcare provider. Some healthcare providers can store a copy of your advanced directive in their electronic health record system, and that may enable you to add and update this information in their patient portal outside of your clinical visits. But there's also a state-recognized electronic advanced directive service, which is through CRISP, that allows you to create, upload, share, and update your advanced directive and healthcare agent information. And Marylanders can learn more at crisphealth.org about how providers share their care information and how they can access advanced directives.
All of which is just amazing to me. And you said that you're in charge of new ways to reach out to people, like telehealth.
Well, so some of the ways that we reach out to people is through telehealth. So what I do is an innovative care delivery. So there are a lot of new care delivery models out there, and they're really based around patients. So some of the benefits to these new care delivery models are it's more a team-based approach. So consumers have the benefit of their providers working on their physical, psychological, and social needs. And their providers come together to develop care plans, coordinate their services, and monitor them to improve their health. And it includes oftentimes collaboration with people like social workers, so they can explore affordable transportation and options to schedule appointments or pick up medications. Um, Another benefit of the innovations in care delivery is the data and technology, like we've been talking about. So access to electronic health records allows the providers to see health history, diagnoses, medications, treatment plans, lab tests, and it helps to better identify potential risks and support your ongoing health and wellness. The care team can leverage technologies like telehealth, which you mentioned, which can be email, video, or a telephone call to help access care when the patient needs it. There's also smartwatches, blood pressure or glucose monitors, which allow patients to share their information with their care team outside of the regularly scheduled appointments. These programs are designed to with the patients at the center. So a patient-centric approach helps to align their needs and wants and preferences to help the care team partner with them to help better manage their chronic illnesses. This results in better outcomes because they do have a wider range of providers working with them, nutritionists, social workers, mental health professionals to help better manage those outcomes. So, when you go to your primary care provider now, it's not just like that doctor or a nurse practitioner. There's often other people that they partner with or even in their office, like the mental health professionals, like a dietitian or a nutritionist or a social worker, even again, to help kind of address these needs because we've this number gets thrown around a lot lately that 80% of medical outcomes are driven by things that are not your medical condition. It's whether you have access to food, whether you have access to transportation, whether you have a safe living environment. So, it's more working with the patient to try to treat all of these things so then their diabetes can be better controlled, their heart condition can have a better result rather than just focusing on, okay, here's your symptoms. I'm going to give you this pill. I'm going to tell you to diet, exercise, and then I'll see you in a year. It's looking at that whole person and what does that person need to help maximize their health.
Wow, you are in a very important and central position in terms of distribution of healthcare. That's amazing. But you collect a lot of data too, right?
Yeah. So, go ahead.
A data exchange, what is
Yeah.
that?
Yeah, so we talked about CRISP and we talked about how doctors can see certain information and how electronic data can really improve the health of others. So, the demand for more complete data and what we call interoperability, so how the systems all talk to each other, that just continues to accelerate and it's rapidly evolving. So in 2022, there was actually a law passed to requiring CRISP, who we talked about earlier, to operate as what we call a health data utility for certain purposes. So what's that designed to do is to really have all of the information. So we were talking about you might be out in Maryland and they might have some medical records, but they don't have everything. The ultimate goal is they can really share all of that information. Everyone can see all of that information. So these models use existing technical infrastructures that are already there where people are already sharing data back and forth. Because as we know that fragmented data can increase that provider burden. If that doctor doesn't know you're on heart medication, they may do certain things that may actually cause your health to disintegrate when you're right there in the ER, right? Versus doing things to help you because they didn't know because you come in and they don't have that information. If we have all this information electronically and everyone can see it, it can just help everybody make a better informed decision at the point of care.
Oh, that's amazing. I want to back up for a second before we close.
Sure.
You guys have a web page, correct?
We do. We
Would
do.
you give us that web page again slowly so that people can write it down?
So it's mhcc.maryland.gov.
That seems easy. Was there any other web page that you think it would be wise to direct people to?
CRISPhealth.org, CRISP health.org is another really good one that people can go to see a lot of the information that we've been looking at today, talking about today.
Do you have any parting advice for people? You covered so much. It was just amazing to hear all of that.
Well, thank you. I think this is a very complicated area. Health costs are not straightforward because there's not a fixed fee for services. Prices vary from provider to provider. It's different for insured versus uninsured. Providers negotiate insurance cost differently. So it makes it really difficult to understand what the real cost of care is. So, what we do at MHCC is that we try to pull all of that together in a way that's understandable and easy to find. So, we support what's called informed decision making to ensure that people are making the best decisions on their healthcare with accurate and timely information. So that's why we encourage people to visit the MHCC website, first visit the CRISP website, and also, talk to your providers, look at their websites. They have a lot of great information out there as well. But we really want to thank you and AARP for allowing us to share information with your listeners.
Thank you so much, and I wish you well this holiday season and stay healthy.
Thank you, Ted.